All right, we're gonna do our head to toe assessment. Hello, Madison, how you doing today?
I'm good. How are you?
Okay. All right, so our patient is alert and oriented. She's cooperative. She's well groomed and neatly dressed today. We're going to start our assessment off by assessing and palpating the skull. So as we do our assessment of the skull, it's normal cephalic. There's no abnormalities noted. She has normal and equal hair distribution. We're going to check our eyes. Before she came in, we did a visual acuity check with our chart, so she does have 20/20 vision. Okay, we're going to assess her eyes. Okay, we just look straight at the light. Sclerae are white, pupils are equal and reactive to light accommodations. We're going to check our ears. We did do a hearing assessment. Her hearing is intact to low and whisper, high pitch noises and voices. All right, so we're going to assess your ears with our otoscope here. Okay. No drainage noted, transparent tympanic membrane bilaterally. There's a scant amount of wax noted on that in that left ear when we're using our otoscope. So now we're going to assess her nose. Okay, just look straight ahead. All right, our septum is midline. Our mucous membranes are intact, pink and moist. There's no redness or drainage noted. We're going to palpate her sinuses. You just let me know if anything is tender. All right, so no tenderness noted when we're palpating the sinuses. We're going to check her throat now. All right, Madison. All righty, you stick out your tongue. All right, perfect. All right, so our oral mucosa is pink, moist, and intact. There's no drainage or erythema noted. So now we're going to assess her neck. The neck is symmetrical. There's no goiter noted. Her trachea is midline. We're going to assess for lymph nodes. Okay. Lymph nodes are palpable and movable, but they are not enlarged. The thyroid is also palpable. All lobes are palpable on the thyroid. But there's no enlargement noted. So we're going to assess the carotid pulses, but we're going to do them one at a time. And they are smooth and brisk bilaterally. All right. So we're assessing our respiratory. We have a symmetrical chest. It's equal, rise and fall with lung expansion. We're going to palpate the chest. And you just note for any tenderness. Is there any tenderness anywhere? Okay, sit up for me. And the tenderness noted anywhere in your back? Okay, good. All right, so now we're just going to listen to all of our lung fields. I need you to sit up straight for me. Turn your back to the camera for me. Okay. We're going to assess the respirations using the H pattern with our stethoscope. Sit up straight. Deep breath. And out. Yeah. 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 So all lung fields are clear. There's no wheeze, bronchi, or crackles noted. So now we're going to percuss the lung fields using the same H pattern. Okay. And as we said, respirations are even and unlabored, and our respiration rate is about 20 breaths per minute. So now we're going to do our cardiac assessment. As we said, we assessed the carotids earlier, and they were brisk and smooth. Bilaterally, there were no bruits, auscultation of the carotids, and once again, we'll listen one at a time. Good. All right, so we're going to assess the PMI, which is, turn my face the camera, which is palpated at the mid-clavicular line, the fifth intercostal space. So our mid-clavicular line, and we'll go down to our fifth intercostal space, and we're going to listen or auscultate for the S1 and the S2 sound. Good. S1 and S2 are auscultated with a regular rhythm and rate. There is no murmur noted. We're going to assess her radial pulses bilaterally, which are regular and even, and about 88 beats per minute. All right, so now we're going to get her to lay down so we can do our abdominal assessment. All right, so our abdomen is flat and soft and non-tender. There's no bulge. There's no mass noted. We're going to auscultate our vowel sounds in all four quadrants. We have vowel sounds present in all four quadrants. So now we're going to do a deep and light palpation, and you let us know if you feel any pain. Any pain noted? All right, good. So now we're going to percuss, and along the abdomen it should be tympanic, and that's what we're getting using the same H pattern. But as you percuss over the liver, you should get a dull sound, which we do. Okay. So now we're going to assess our musculoskeletal. So can we get you to sit up? I'm sorry. All right, we're going to get you to stand up for us. Face the door. All right, so we're going to get you to, all right, we're going to get you to put your chin to your chest. Good. Can you put your chin on your shoulder, left and right? Good. Can you bend down and touch your toes? Good. So we have, you sit up. So we have flexion and extension in both the neck and the back and the spine without pain. Now we're going to assess her gait. Can you take a few steps to the door and then walk back? All right, our gait is normal and steady. She's able to bear weight without pain. Now we're going to check her range of motion. You can sit down for me. All right, and we're just going to check range of motion. Good. Does any of this cause you any kind of pain? Good. Okay. Good. Good. Any pain anywhere? Good. So we have range of motion, full range of motion in all joints. So now we're going to do our neuro assessment. As we mentioned earlier, our patient is alert and oriented ×4. Madison, can you tell me the date?
June 14, 2021.
Okay. So alert and oriented ×4. We check muscle tone, which is a 5 out of 5 in all four extremities. We're going to check for sensation. You let me know when you feel the sharpness.
Yes, ma'am. Yes, ma'am.
Okay.
Yes, ma'am. Yes, ma'am.
Okay. So we have bilateral sensation. She's able to feel pain and distinguish temperature, touch, and vibrations. We're going to check her reflexes. Relax your knees forward, uncross them. And we're going to use the bell of our stethoscope to check reflexes, and there's 2+ reflexes bilaterally. We're going to check our cranial nerves, and we kind of did some of that when we were assessing her arms. So when you look at me, I want you to follow my finger, adjust your eyes. Good. Can you puff your cheeks? Can you smile? Stick your tongue out? Good. All right. And as I said, we already assessed all the other cranial nerves, so cranial nerves 1 through 12, and cerebral functions are intact. We already assessed her gait, which was steady, and coordination was intact. Thank you very much.